One of the most important tenets that guides prenatal care of the twin gestation is early and reliable assignment of chorionicity. Although monochorionic twins make up about 30% of all twin pregnancies, they experience over 70% of the complications that are seen in twin pregnancies. So early identification of a monochorionic twin pregnancy allows institution of a care plan with early monitoring, particularly for the development of twin-twin transfusion syndrome, a condition where there's unequal sharing of the vascular flow in the shared placental mass. And we know that early identification of TTTS and early treatment, in fact, improves both morbidity and mortality for the pregnancy. When I think back over my career in prenatal diagnosis, one of the most challenging types of twin gestations that I evaluated were pregnancies in which there was not an early assignment of chorionicity and there was significant discordance between the two twins with respect to both birth defects and growth. And it made it extremely challenging to counsel the family about the risks to one compared to the risks of the other. And knowing with certainty, non-invasively, whether or not they were dizygotic or monozygotic would have significantly changed the counseling of that family.
The earlier a clinician is able to determine chorionicity, the better. Traditionally, this has been done by ultrasound. Ultrasound, however, can be inaccurate. Specifically, around 20% of patients with monochorionicity will be misdiagnosed as having a diamniotic dichorionic placentation. As such, these patients will lose the opportunity for regular surveillance, maternal fetal medicine consultation, and early detection of twin-to-twin transfusion syndrome. The Panorama test is unique amongst the NIPT tests for fetal aneuploidy in that it uses a SNP-based platform as opposed to random or shotgun sequencing. As such, it is able to determine the genetic makeup, the zygosity of the twin pregnancy as early as 9 to 10 weeks. And it can accurately tell you the gender of the individual fetuses. If you know that a twin pregnancy is monozygous as early as 9 to 10 weeks, that patient should be referred to maternal fetal medicine specialists given the risk of monochorionicity and twin-to-twin transfusion syndrome. So I believe that the ability to accurately determine zygosity as early as 9 to 10 weeks of gestation will be a major advance in the management of twins. It will allow us as clinicians to more accurately interpret the aneuploidy screen, and it will allow us to triage patients based on their risk for twin-to-twin transfusion syndrome.
Natera's Panorama non-invasive prenatal testing is now validated for twins. This represents a major advancement in managing twin pregnancies.